Many people in our community are unable to communicate as effective as a normal person within the community, and this is because of missing an important aspect of communication, which is the hearing sensation. In this video, I'm going to be addressing a solution that will help people to develop their hearing sensation. The agent that will help people is a medical device called cochlear implant. Cochlear implant is a perfect example to demonstrate the integration between neuroscience and technology. However, before I start talking about what is cochlear implant, I'm going to go a couple of steps back and talk first about what is cochlea. Cochlea is a hollow spiral-shaped bone found in the inner ear that plays a key role in the sense of hearing. Participate in the process of auditory transduction. Sound waves are transduced into electrical impulses that can be interpreted by the brain as individual frequencies of sound. The spiral shape, along with semicircular canals and organ of cortium, allow for different frequencies to stimulate a specific area along the spiral shape, which leads to forming what is called a synoptic map. Synoptic map enables people to perceive various frequencies of sound. Specific areas along the cochlea are stimulated by vibration carried within the fluid known as endothelium that is found in the cochlear duct. The vibrations are then converted into electrical impulses in the cochlear duct through mechanical stimulation of hair cells within special structure known as organ of cortium. These nerve impulses the are carried by vestibulocochlear nerve from the cochlea to the brain for interpretation. One of the etiologies specific to cochlear dysfunction is noise damage. Noise damage occurs during sustained exposure to extremely loud noise. Exposure to sound of 85 decibel or greater for an 8-hour period can lead to permanent cochlear damage. The damage associated with loud noise exposure destroys the hair cells in the cochlea. Loss of hair cell leads to inability to stimulate afferent nerve and therefore an inability to hear sound of various frequencies. There are three implications of hearing loss: fewer educational and job opportunities due to impaired communication, social withdrawal due to reduced access to services and difficulties in communicating with others, emotional problems caused by a drop in self-esteem and confidence. A very common device used by many patients with inability to hear sound is hearing aid. Hearing aid is a small electronic device that look like a wireless earphone. It amplifies the sound vibration entering the ear so that surviving hair cells can detect the larger vibration and convert them into neural signals that are passed along to the brain. While hearing aid amplified sounds, if the cochlea is severely damaged and many hair cells are missing, amplified sound won't get passed. Therefore, Therefore, people who are hearing aids with limited success and have severe profound of sensorineural hearing loss in both ears need to use alternative treatment device that can replace their damaged inner cells and stimulate hearing sensation, resolve sensorineural hearing loss. In the earliest In the earliest century, an Italian scientist named Alessandro Volta placed two ends of 50 volts battery to his ear to generate an electric stimulation. The unpleasant sensation was likely to be the first demonstration that electric stimulation, instead of sound and light, can induce auditory and visual sensation. In honor of Volta's work in many different fields in electricity, an, an, an annual Volta Prize was established. In the latest 17th century, the most notable Volta Prize went to Alexander Alexander Graham Bell. Bell was Bell had established an enterprise which conducted an early comprehensive research in hearing and speech that forms a theoretical foundation needed for later success of a device called today cochlear implant. For example, Bell's theoretical research described how to resample speech out of electrical signals, which have been absolutely critical to the development of signal processing in modern cochlear implant systems. However, not until 1984 that the 3M house signal electrode implant was the first cochlear implant came to commercialization after its approval from Food and Drug Administration. Cochlear help children and adults who are deaf or severely hard of hearing can be fitted for cochlear implant. The difference between cochlear implant and hearing aid is that cochlear generates electrical signals that can bypass the damaged hair cells and directly stimulate auditory nerve. The auditory nerve will then send signals which called neurotransmitter to the brain, which will recognize the signals as sound. The exact process is that the external transmitter detect environmental sound and digitally convert them into electrical signals. The electrical signals are transmitted along electrode array to stimulate specific location of the cochlea responsible for specific pitches. This targeted stimulation across the whole cochlea provides a more accurate pitch perception for a better sound quality. By mimicking the natural function of hair cell, these pulses can deliver sound signals directly to stimulate the auditory nerve. The, these signals are then transmitted by the auditory nerve to the brain where they are interpreted as a sound. Hearing through a cochlear implant is different from normal hearing and takes time. And takes time. Scientists are exploring whether using shortened electrode array inserted into a portion of the cochlea, for example, can help individuals whose hearing loss is limited to the higher frequencies while perceiving the hearing of lower frequencies. The use of cochlear implant requires both surgical procedure and significant therapy to learn sense of hearing. The process can be expensive, in which insurance may not cover the expenses. Sur- Surgical implantation are almost always safe, although complications are a risk factor, just as with any kind of surgery. An additional consideration is learning to interpret the sound created by an implant. This process takes time to practice. Speech language pathologists and audiologists are frequently involved in this learning process.